Good morning, everybody. As Jennifer said, my name is Dr. Isla Damastrup, or as most people call me, Dr. Isla, because that last name's a mouthful and no one has time for that. I'm really excited to be here to talk to you today about functional communication training, which is an evidence-based approach and treatment intervention to decreasing challenging behavior. But before I get into that, just a little bit about me. Like I said, I'm a licensed psychologist and board-certified behavior analyst. I currently work at the Kennedy Krieger Institute in the neurobehavioral unit, which is a unit that has an inpatient program as well as an outpatient program that specializes in the assessment and treatment of severe challenging behavior exhibited by children, adolescents, young adults with a varying range of developmental disabilities. So we've had children with 1P36 as well as autism, other genetic syndromes, intellectual disability, developmental delays, all who are exhibiting behaviors that interfere with their quality of life. So that's who I am, but to talk a little bit about who I am not a speech-language pathologist, so I want to make that clear because I'm going to be talking a lot about communication today, and there's lots of things about communication that I do feel like I'm pretty well-versed in, but I'm not an SLP, and that's very different, and that's some of what I want to talk to you about today, is some of the differences between speech-language services and functional communication training. So what I am is a behavioral psychologist, as I said, with a lot of experience, over 10 years of experience of using functional communication training as interventions to decrease those challenging and maladaptive behaviors. So as I said, a quick overview of what I'd like to be talking to you about today is some of the differences and similarities between speech-language therapy and functional communication training, because I feel like those terms get thrown around a lot, and there are some similarities, but there's certainly a lot of differences that I want to try and highlight and differentiate for all of you. And then I'm going to go into some more details about the functions of behavior. So anybody who was here last year is going to be like, okay, some of this is ringing a bell from what I talked about last year, but really tying it to that piece about functional communication training in a little bit more detail. So again, why am I here talking about communication when I just told you, well, I'm not a speech-language pathologist and I'm not an expert in speech and language and communication. But that's because in some ways, I actually don't think speech and communication are exactly the same thing. You know, I think there's some really big differences there. And I hope that I'm able to help clarify that for you and help you think about your child's approach to communication and how that might be different from their language development. And again, I know that's going to sound a little bit confusing and maybe misleading, and I hope that throughout the course of today, I can help clarify some of that for you and why I feel that way, and maybe you'll see some similarities with along my line of thinking. So briefly, when we're talking about what speech therapy is, it's a treatment that improves your ability to talk, use other language skills. It helps you express your thoughts, understand what other people are saying to you, and actually can also improve your skills like memory and how you solve problems in terms of your broad bases of language. Some of the goals of speech therapy may include things like word pronunciation, answering questions, naming objects. If I can just do a quick raise of hands, how many children here are receiving speech therapy? Okay. So this is probably sounding familiar to you guys, right? In terms of those goals that you're discussing with your SLP, what you're trying to target in terms of those bases of language. Now, so what is functional communication training? So it's a common function-based treatment that has actually been around for a really long time. I have two titles of research articles here for anybody who's really interested in that side of things. One from 1985, which is actually when FCT was first published as an evidence-based approach for reducing challenging problem behavior. And then another really great paper from just a couple of years ago, from 2021, with the group that Gamagani et al. Who summarized the years and years and years of FCT-based research to look at how that approach has been used to try and decrease challenging behaviors for individuals with a wide range of diagnoses as well as problems. So the biggest difference here from FCT and speech therapy, that again, I'm going to keep saying these words, functional functions of behavior today, is just that. FCT is really tied to the function of the challenging behavior that you're trying to address. So the goals are going to be a little bit different. They're centering around how do we help decrease these challenging behaviors, as opposed to those speech therapy goals about how do we broaden language and speech abilities. So both speech therapy and FCT approaches are designed to help address the individual needs of a child. And I really want to emphasize that too, that while I'm talking really broadly about these two types of therapy, the focus of both of those needs to be on the individual needs that the child experiences in their deficits in language and communication, as well as challenging behaviors. Both really, the goals are going to be focusing on increasing independence through those different types of goals. And they're also going to be open and using multiple modalities when they're intervening in their therapeutic sessions. And so what do I mean when I'm saying multiple modalities? That's a pretty clinical term. And that's just meaning the different types of ways that we can be communicating. So both FCT and speech therapy can target improvements in the use of vocal verbal language. So many children have that ability to use their voice in terms of that vocal verbal language. And FCT and speech therapy both are going to be targeting ways to shape that use of language and improve that vocal verbal language. Some pros of that approach is going to be that it's pretty globally understood, right? Everybody can understand when someone is talking to them using their voice. But the downside is that it can take a really long time to improve or increase the use of that form or that modality of vocal verbal language. Pictures, use of picture exchange is a really broad term or approach in both speech therapy as well as in FCT. And it can be really different in how it's used in both of those modalities. So I'm still talking about similarities, but I'm going to throw in some differences too. So we use pictures in FCT all the time. It can help teach receptive language as well when we're signaling what is and is not available to a child. And one thing I wanted to clarify specifically is the term PECS versus picture exchange. So the picture exchange communication system, that full title, or PECS, is an alternative communication system that was actually developed based on the theories of applied behavior analysis. Who here's heard the term PECS before? Okay, so a lot of you have heard that before. So it is in fact a form of functional communication training, but it differs in that it's really systematic. So someone should only be saying they're using PECS if they're going through the full, it's a 6 specific phases of training to use picture exchange for communication systems. So PECS, which includes the term picture exchange, I realize this is confusing, is actually very different than just saying, oh, I'm doing picture exchange as a form of communication. And just a quick extra on that. So PECS has actually been also around for quite a long time. This is one of the original articles that was published back in 1994 by Bondi and Frost, where it talks about the development of this very systematic 6-phase protocol of teaching PECS. It's been implemented with thousands of individuals experiencing a variety of challenges, and it, again, uses those principles of ABA, including prompting and reinforcement strategies. Some of the phases include, just from the very beginning, exchanging a single picture for an icon, and then it works its way up in difficulty to things about commenting on the environment and emotions. And so while I use a lot of picture exchange, I am actually not fully trained in using PECS. So that's kind of that difference there, that I do a lot of FCT using pictures, but I actually don't use PECS, that whole full system. So I want to be cautious of that. If you're working with individuals who are saying, yeah, we're going to do PECS, asking those follow-up questions, oh, are you doing the 6 systematic phases of PECS? And they might be like, what are you talking about? Okay, so now you're going to be able to say, oh, so we're doing picture exchange. Still a great approach, but we want to make sure that you guys are understanding sort of what your therapists are working with you on. Another modality is, of course, a speech-generating device, seeing lots of those around here, which is wonderful. All the more advancements in technology have really helped to support a lot of individuals' ability to communicate and have a broad approach to communication. Another pro of the speech-generating device is that it is universally understood, right? Most people are going to know what you're saying as you push a button. But this can also be pretty complex to teach. I myself struggle with navigating some of those speech-generating devices for clients that I work with. And they can it's also limited if that device isn't available, if the battery dies, or if you leave it somewhere, then it can be tough to kind of continue to promote those appropriate communication options. Other forms of speech-generating devices can be a little bit simpler. So here we have 2 examples of a switch or a Big Mac button. And these are buttons that you can record your voice or someone's voice on, saying any target that you want to help the individual understand, hey, I pressed this button and this is going to be my voice. It's a great teaching tool, but of course is limited in its scope. It's 1 and 3 options here for what is able to be communicated. And similar to the more complex speech-generating devices, it needs to be available at all times for it to be purposeful and functional for that individual. Sign language is, of course, another modality that can be taught, and it allows for some modifications if there's fine motor impairments, can be pretty complex in terms of its options in terms of what you're targeting and what you're teaching. A great thing about sign language, similar to your vocal response, is that it's always available, right? You don't need anything extra with you. You always have that ability to communicate appropriately, but the more difficult thing can be that it's not always universally understood. So your language partner has to be understanding of what those signs mean for it to be a really effective tool. And that's where I think speech therapy services as well as FCT are both great because they can use multiple options here, right? We can take a multimodal approach and combine some of these things together to best meet the needs of the individual. So I've already sort of touched on some of these, but to get into some of the differences between speech therapy and FCT, the first being that, again, speech therapy is going to have wide-ranging goals, a different emphasis on those broad bases of language, talking about all aspects of a child's communication goals and things that you want to see for them. Whereas FCT is going to be a little bit more narrow. It's more specific identification of intervention targets that I'm going to go into in a lot more detail soon. And in a lot of ways, I really think about FCT as being a foundation or kind of the building blocks to prepare an individual to be successful in speech therapy, right? If we've gone through some really focused, specific functional communication training where an individual learns, hey, my language, whatever modality that is, results in me getting things that I want, they may have a better preparedness and understanding to transition into effective speech therapy services. So when might you need speech therapy? Many of you are probably familiar with some of the diagnoses listed here because that's why you sought out speech therapy. That's why so many of you raised your hands saying that your child is receiving speech therapy because they've been diagnosed with a very specific speech, language, thinking, hearing, or swallowing disorder. And I turn to the American Speech Language Hearing Association, or ASHA website, quite often, even in my work as a psychologist, to see what speech language pathologists are doing out there, look at their literature, to help me understand some of the diagnoses that clients I work with may be experiencing. So in my work, I'm not challenging them outside the scope of what they are able to do in terms of their communication. So it's a great resource for those of you who may be somewhat more familiar and understanding of some of these diagnoses, or those of you who have questions about them. It's really able to help understand some of those differences between speech, so how they define it as how we say sounds and words, versus language, which is what they define as the words we use, how we use them, and to share ideas and to get what we want. They also provide some really great information about early identification for speech, language, and hearing disorders, as well as how to understand the differences between like a language delay versus a language problem. So I highly encourage you to check out the ASHA website if you have questions about anything related to more of that diagnostic side of language and communication disorders. So conversely, when might you need FCT? So the need for a treatment approach like FCT isn't based on any particular diagnosis or disorder, but it's going to be relevant for any individual who's engaging in challenging or maladaptive behavior when they're unable to get their needs or desires met. So those communication deficits are less about, I don't have the ability to use my voice to communicate, but it's leading to such frustration that I'm engaging in challenging and dangerous behaviors because I can't communicate what I want to, or because I can't get what I want to. So those are two kind of differences there that I hope you're starting to see as I keep talking. So here's a table, and these are just examples of challenging behaviors that have been referral concerns to our clinic at the NBU. And here the main emphasis is that all of them have been interfering with an individual's quality of life and safety. I can say that FCT has been used to effectively decrease most or all of these different topographies or challenging behavior. But again, I want to emphasize it's not the type of behavior that's really that important when determining whether functional communication training is going to be an appropriate intervention approach. It's going to be about why is that behavior happening, which is what I'm going to get into now. So before we even talk about using FCT, again, we need to understand why is problem behavior occurring, and we need to assess that at the individual level. So even though we know, for example, here with some of our 1P36 kids, many of them engage in things like hand biting and some of those very specific topographies of behavior that are similar, really that doesn't mean that there's a similar reason why each of those children are engaging in that behavior. And so that's where it's a little bit different. We know patterns about kids with the same diagnostic profile, but we still need to assess that why question at the individual level. And research tells us that across individuals who engage in challenging behavior, regardless of diagnosis, 60 to 75% of them are related to social variables. So that means those problem behaviors, and this may be familiar to some of you, are to get attention or get a reaction from other people. The behavior is to get access to their preferred items, preferred foods, preferred activities, preferred places, or the behavior is to avoid non-preferred things or get out of doing work, get out of doing something they don't want to do. And most of the time it's some combination. It's rarely just going to be one of those options, and rarely it's multiple options that are going to be that why for the behavior. So how does that help us? So if we know why it's happening, then we know where to start, right? So that's where functional communication training really comes in. We need to start thinking about things like what modality of those that I reviewed previously, as well as potentially others, is going to be a good fit for the child, and what modality is a good fit for the family. So I'm going to keep saying and reminding you that if you've met with me already, you've probably heard me say this, like, you need to be talking about your individual goals, your family goals, what you think is going to work best for your child as well as for your family. That being said, sometimes what you think is going to be best may not actually be what's best for your child. So one approach that we take a lot is having a full conversation with a caregiver. Hey, what types of language does your child currently use? What's going to be easiest for you to implement at home, whether that be a speech generating device, something vocal, or using a picture exchange. And sometimes I actually will work to teach a child multiple modalities and then see which one they actually like to use the best, right? So if we've taught multiple ways to ask for the same thing, and then we see, hey, which way do they rely to, right? Because some individuals who have vocal verbal language, when they get frustrated, that might be too difficult to use that language, and therefore having something like a picture exchange or a sign is going to actually help them in those most frustrating moments. And that's where, again, talking about FCT being a building block, a foundation of working through tough moments to help prepare them for their continued language development. So the other piece of how does this help is that the social variables are actually in control of caregivers. You guys have more control over what's happening in those moments than you may realize. And clinically, we talk about that as the form of differential reinforcement, where we increase your response to appropriate communication that we've hopefully taught through FCT, while decreasing your response to the challenging behavior. So I'm probably asking this earlier than I mean to in the presentation, but who here has been told to ignore your child's problem behavior? Okay. That's not as many as I thought, actually. And so I definitely think that's something that's important to remember, but I think a lot of folks are being told to do that maybe a little bit early at the wrong time, because what we need to know is that increasing your response to a communication approach before we start limiting your response to problem behavior, which I'll get more into in a second. So again, if you saw me talk last year, you may have seen this visual where I'm going to review some of the ABCs of behavior, or what we call the three-term contingency. So the A in this situation we call the antecedent. That's what's happening right before a behavior occurred. The B is the behavior of interest. So for us right now, and what I'm talking about, it's that form of challenging behavior. And the C is the consequence, or what happens in response to the behavior. So you can see right now the behavior of interest that I'm going to use as an example for a few things is someone biting their own hand. So a child's biting their own hand. So First example, that antecedent becomes, oh, you took away a toy, and then the child bit their own hand. Oftentimes the consequence, maybe not consistently, but sometimes you're going to give that toy back because they've been biting their hand and you know that'll make it stop, right? So that's a variable where a child is showing you with their behavior, and again, these are very simple examples, it's not always that straightforward, but they're showing you with your behavior that they want that toy back, and they've used biting their hand to get that back from you. So that's example 1. Example 2, a caregiver is helping a sibling. Their attention is pulled away to help with something else, and the child engages in that same behavior. They bite their own hand. Here, what often happens is a caregiver may say, hey, stop, don't do that, and they come over to the child and they're trying to set them up with a different activity, and what that instance of biting their own hand has shown the child is, oh great, when I bite my own hand, you come over to me and you give me some attention in this situation. Example 3, you've prompted your child to pick up some toys and they bite their own hand. And because they bit their own hand and you're like, this is just gonna take too much time, I'll just pick up the toys myself. So in this situation, biting their hand has actually gotten them out of doing some sort of a chore or a task. So here we're talking about how the same behavior, biting their hand, depending on what happened before and what happened afterwards, can be used in 3 different ways to be communicating something to you, and therefore kind of having some control over your behavior. And what functional communication training is designed to do is get you back in control of those situations and helping your child learn that that behavior of biting your own hand, regardless of what's going on, isn't necessarily going to work that way anymore. So what do you do now? I've just told you all of this information, and if you're having some light bulb moments of like, oh man, this is mapping on to some of the things that I see, or I'm starting to think through examples of when my child's engaged in challenging behavior and seeing these patterns, you want to get some help and support. You know, I'm talking about FCT in a way that I hope is pretty accessible, but it's still something that you want some input on. It's not something you can fully do on your own. And so jumping to some local universities or colleges, seeing if they have clinics. I myself, in my graduate program, worked in a school psychology clinic at the University of Georgia, where we did therapeutic interventions for children there. And so it's a great opportunity to access people who are really passionate about this field and getting their education and are supervised by qualified individuals, and get some support there. Of course, checking with your insurance providers and looking for in-network behavioral psychologists, board-certified behavior analysts, but also speech-language pathologists. So I work with a lot of SLPs who also have a lot of behavioral-based training, and so it's just a matter of finding someone who has expertise in both that SLP world as well as the behavior and FCT kind of world. But that being said, I think you do have the power to start recognizing these patterns, and you may be able to work on some of this stuff on a very small scale on your own. So when I'm talking about differential reinforcement, those opportunities are occurring all the time, and you guys just have to start thinking about things in that term of ABC, what's happening before, what happens after, and starting to recognize that you have some control in those situations. So for example, what does this picture mean? Who can go ahead, Callie. Yep, the child's reaching out, probably wants to be picked up, right? That's a pretty universal sign for wanting to be picked up, and most people will probably pick the child up, right? But what if you can't? The child might start tantruming, which is totally normal, right? But if that's when you pick the child up after they've started tantruming, in that one situation, we've shown them, hey, this didn't work, but crying worked. And again, this is a very simple example, and that happening one time is obviously not going to create a super challenging situation or a challenging future, but it's just a really clear example of how you are constantly using differential reinforcement, both in the way of like, oh yeah, when they do this, I pick them up. They're functionally communicating, and you are giving them what they want in that situation. Similarly, if I were to stand up here and do this, looking over at Jennifer and do this, what am I saying? Exactly, yeah, I'm saying I would like a drink, please, right? But if I were to not get that drink, and I might start banging the microphone on here, and that's what gets me the drink, Okay, well, now I know next time I need a drink, I'm just going to start banging the microphone instead of using something much more appropriate, like signaling that I need a drink. So again, those are just very simple examples of how what happens after a behavior, what happens before a behavior, can really impact the future of what that might mean for any individual. All right, so again, differential reinforcement. We're talking about showing that the problem behavior no longer works. But this is where anyone who's been told, oh, I should just ignore the problem behavior, that's really only half of what needs to happen, and is really the second half of what needs to happen, in my opinion. But when we're talking about ignoring, that means that we're withholding that attention response, we're not providing preferred items when the problem behavior happens, and we're gonna try and keep encouraging the individual to finish their work or the prompt that's been delivered to them. But again, the thing that needs to happen first, in my opinion, is that appropriate replacement behavior needs to be taught and repeatedly reinforced, right? Just because you do it one time doesn't mean that you've mastered it, doesn't mean that you fully understand that, hey, this is gonna work for me in the future. So it's both things that really need to happen, but I would actually really caution against ignoring any sort of challenge behavior before you've started to work on, hey, what is gonna help my child get access to this thing that they want, even if it's my attention, more appropriately before I just start ignoring the problem behavior. Now, that's not to say that you can't start sort of decreasing that response. Anybody who talked with me yesterday, I probably talked about that with you, of like, hey, this is something that's a longer term goal, but you can start to limit how you respond to that problem behavior while trying to find ways to differentially reinforce or provide that attention contingent on appropriate behavior. But again, this is going to take a lot of different forms. First, we need to answer that why. Why is the behavior happening? Understand the function. And then, of course, take into account the skill set of your child and what their needs are, what their communication abilities are going to be, and what types of supports you have to be working on this as a long-term goal. So to recap, functional communication training really needs to be function-based. It needs to match that why the problem behavior is happening. Because if, for example, if we had a situation where you started teaching a child to ask for help when they're doing their schoolwork, but they don't want help, they just want to go play with their tablet, well, then we're not really helping them match that communication response to what's going on in the moment. So that's where, again, it can take a lot of practice, take a lot of data, looking at patterns over time. Is it that my child wants help with their schoolwork, or is it that they just would rather go play with their iPad? Those are two very different sort of situations, and something that needs to be teased apart before you start FCT. And again, communication can equal lots of options, right? I really prefer to often try and teach a client when we're doing FCT multiple ways to communicate for one thing, and let them have that full repertoire and help them understand that there's multiple ways to get what you want appropriately without using that challenging or maladaptive behavior. But FCT is really just the beginning. Intervention is going to be continuous. You know, what I'm talking about right now, if you haven't picked up on it, are things like, oh, every time they ask for the tablet, I'm going to give it to them. Well, that's not realistic. I know that. You know, but that's where we have to start in terms of some of that intense intervention of really reshaping that, oh, this new way I have to communicate is what is appropriate, and that's going to be what gets me what I want. But then we need to start working towards those realistic goals. So, okay, yeah, sometimes you ask and you're gonna be said, sure, you just gotta wait because it's charging, or you gotta wait because I'm cooking dinner. Sometimes the answer is gonna be no, and you have to just tolerate that. So those are the types of things that I know are super duper important for all of you, but that's gonna take time, and we need to start at a really, really early stage of that intensive FCT before building upon that, as well as building upon, again, those broader speech and language goals that are incredibly important for you as well as for your child's development. The other thing is that skills can be lost or decrease without time, or decrease over time. You know, I graduated high school bilingual in French. Do you think I can still speak French? No, because I have not used that in a very, very, very long time. So keeping in mind that just because your child's mastered some sort of a response, some of that relies on you continuing to reinforce it. So if they start asking for things, and I know this can get annoying when you're asking, but you never respond to that in a way that gets them what they want, well, they're gonna stop using it, right? And so it's finding that balance of working towards those realistic goals of you have an appropriate way to communicate now. I'm not gonna let your problem behavior dictate everything, but also we're working towards sometimes you have to tolerate no and being told to wait. So that's why I'm saying it's just the beginning when we talk about FCT. It can be a really long journey to get to those reasonable and realistic goals. And the other thing to remember is that problem behavior is never going to be totally eliminated. You know, we always emphasize in our program, like we want to develop effective interventions that can help reduce the challenging behavior so it's happening way less often, it's happening way less intensely, and most importantly, when it does happen, you as a caregiver have the tools to know what to do in that moment. But we have to remember, sometimes a bad day is just a bad day. You know, it doesn't mean that your interventions that you've been working on aren't working. It just means there's an off day. We all have them. And unfortunately, sometimes for our kids, an off day just means a higher rate of problem behavior. And that's really frustrating when you're working so hard. But those are the times where it's that much more important that you're consistent with using those strategies of differential reinforcement, using any interventions and speech language pathology strategies that you've been developing with your team of support, and continuing to be as consistent as possible and get back on track. As always, I went really, really fast because I talked too fast. So please let me know if you guys have any questions, and I just really appreciate your time. Please feel free to reach out to me if you have questions about anything I talked about today. I know many of you have specific questions about your individual child, which if you don't have time, or if you weren't able to sign up for a consult with me today, I'm not sure if we'll have full time for that, but certainly please feel free to email me. We can set up a time to talk, but thank you.
And if anybody has any specific questions, I think we have a few minutes for questions if anybody has anything for her.
Hi, I was wondering, the FCT, I know that one of the next steps, if you're interested in that, could be to reach out to behavioral analysis or like to ABA Center. Is that different than normal ABA? Like, this is something that's never been talked about or offered to me. So would anybody be trained in that?
Yeah, FCT is absolutely a part of applied behavior analytics services. So again, that's where it's really focused on the goals that you have for your child and communicating that with your ABA therapist. Generally speaking, I would say most BCBAs are going to be very familiar with FCT and how to go through that. It's usually done in a very specific trial-based format and heavy repetition before sort of expanding it to more realistic contexts. But absolutely, that's something that if that's appropriate for what you're sort of connecting with what I've talked about here today of, wait, you know, my child doesn't have a way to communicate for this, and that usually seems to be the ABC pattern, absolutely talk to them about doing some FCT and seeing if you can get trained in it as well to help them practice using those skills.
Thank you.
Yeah.
I know with my son, once we got his autism diagnosis, that opened up a lot of doors in our area, and we're in North Texas. And my mom worked for special ed for a long time, so we were already kind of doing some of the FCT stuff. And I know with my son, he always asks for iPad or a device. And when we get back home, when he starts asking, we'll be like, hey, get your iPad, set the timer for 5 minutes. When it goes off, then you can have it. Because we've been working on trying to not necessarily limit the time, but I guess limit the time of him having the device. And I know some of our kiddos that might help with that time differentiating with, because they're wanting us to work on like having quiet dinner. So he goes on, he sets his iPad for however many minutes. I think we're working on 5 minutes right now. So he has that device at the table, sets a timer for 5 minutes, set whatever sound he wants it to go, sets it down. He's eating, we're talking, having a good time, and then we're out at a restaurant. He doesn't get his iPad till after we've ordered the food, because I figure that's about, at least 5 minutes by the time we've ordered our food and got its food decided. So maybe that might be some helpful hints for those kiddos that are a little bit more higher functioning, or even lower functioning to be like, okay, they hear the timer and then they can maybe re-ask.
Absolutely. I think the use of timers and other sorts of visuals are super helpful in terms of once you've gotten past that just FCT and you're working towards realistic goals like that. I went back on the slides to this one where there's that red and green board. So this type of approach is something that we use a lot. It's called signaled availability. So a lot of times once we've worked on FCT, once a client has mastered an appropriate communication response for something, we'll stick with the iPad, where they know how they can ask for the iPad and they get it. And we start to say, okay, well now it's not every time you ask you can get it. We use sometimes something like this red-green board, as that sort of receptive understanding. So even if they're verbally asking for the iPad, we may, as you see here, have a picture of an iPad on this red side and again, systematically start to teach them, hey, when it's on red, even if you ask nicely, you're not going to get it. And we're showing them it's not available right now. And we start as small as 3 to 5 seconds. It's on red for 3 to 5 seconds. Okay, it's back on green. If you want it, you can ask for it and you're going to get what you want. So that's, again, designed to both help the child understand when their requests are going to be rewarded or when it's like, nope, it's just not an option right now. And also helps you as a caregiver start to have some control and some structure as to when certain things are going to be available or not. Similarly with, I think, more in your line of example, when it's like, we got to wait. So use of timers are great for that situation. Like, hey, you asked, okay, nice job asking. Thanks for using your communication, but it's time to eat, so you have to wait. And again, most times you're going to start really small. That timer might be set for 5 seconds. Okay, you waited 5 seconds without any problem behavior. Awesome. Now you can have your iPad. And very slowly increasing that to, again, what's realistic and appropriate for you as a family, and also what your child can respond to in terms of that wait. And that's where, again, looking at patterns, I think, is something that you as caregivers are able to start doing. But this sort of more intervention approach is where you really need to get some support and start asking about using FCT and other sorts of behavioral interventions to address those goals that you have. Thank you for bringing that up. Yeah.
So you mentioned how the child reached out and was asking, but then the behavior happens too quickly. Say my hands are busy and she already bit her. She asked properly.
Yeah.
But then she bit her hand and then you respond. So how do you redirect or reroute? I mean, what's the solution, basically?
Yeah.
What do you do?
Well, and that's the kind of situation where you want to be having a professional help support you in those moments, because some of it is it is going to involve situations where a child has to experience some frustration because they're resorting back to that problem behavior too quickly, and we need to show them, again, with support, with safety in place, that biting your hand isn't going to get me to come over to you right away. We might block, we might do other things, but we're not going to pick you up in this situation, right? So it's finding that balance, and that's where having a provider help you work through those moments is going to be super important, because I'm absolutely not telling you to go home and say, okay, she bit her hand, so I'm not going to pick her up. No way, because I want you to be able to feel confident that your child has the skills to communicate appropriately and that you have the support to work through those potential moments that might happen where you're trying to encourage that more appropriate communication. So I don't have a short answer for it right now.
Okay.
All right.
Dr. Isla, I want to thank you very much for your presentation.
Of course. Thank you, guys.